Hello and welcome to the topic Risks and Probabilities in the module Statistics. Here we will be looking at relative risk and relative risk ratio, numbers needed to treat, absolute risk reduction, odds and odds ratio, as well as pre- and post-test odds and probability. Let's get started. Relative risk ratio or RRR equals to the rate at which events occur in the experimental group, which is defined as EER, divided by the rate at which events occur in the control group, which is called CER. For example, if we look at a trial comparing the use of paracetamol for dysmenorrhea compared to placebo, we may get the following results. So here, the experimental event rate, which is EER, equals to 60 divided by 100, and the control event rate is 20 divided by 80. Therefore, the relative risk ratio equals to 0.6 divided by 0.25, and the answer would be 2.4. If the risk ratio is more than 1, then the rate of an event is increased compared to controls. Relative risk reduction equals to 1 minus relative risk. Numbers needed to treat an absolute risk reduction. The absolute risk reduction equals to control event rate minus experimental event rate. Numbers needed to treat is 1 over absolute risk reduction. That indicates how many patients would require an intervention to reduce the expected number of outcomes by 1. Example, if a study for stroke reveals that 20 patients need to be treated to prevent one event, that means if you treat 1,000 patients, then you will expect to have 50 fewer strokes. The number needed to treat is calculated by 1 divided by absolute risk reduction. Numbers needed to harm equals to 100 divided by absolute risk. For many studies now, papers quote the number needed to harm. This uses the same principle to establish the difference in absolute risk of an adverse event occurring between two treatment strategies, calculating a number needed to harm by dividing 100 by the absolute risk. Odds and odds ratio. Odds are ratio of the number of people who incur a particular outcome to the number of people who do not incur the outcome. The odds ratio may be defined as the ratio of the odds of a particular outcome with experimental treatment and that of control. In contrast, probability is the fraction of times you would expect to see an event in many trials. When expressed as a single number of probability, is always between 0 and 1. So if we take an example of rolling a dice, the probability of rolling a 6 is 1 over 6 or 0.1666. The odds of rolling a 6 is 1 over 5 or 0.2. Odds ratio are the usual reported measure in case control studies, and it approximates to relative risk if the outcome of interest is rare. Odds of achieving significant pain relief with paracetamol in the given data is 40 over 20, which is 2. Odds of achieving significant pain relief with placebo would be 30 over 60, which is 0.5. So the odds ratio here will be 2 divided by 0.5, which is 4. Pre- and post-test odds and probability. Pre-test probability is the proportion of people with target disorder in the population at risk at a specific time or point prevalence or time interval called period prevalence. For example, the prevalence of rheumatoid arthritis in the UK is 1%. Post-test probability is the proportion of patients with that particular test results who have the target disorder. A post-test probability equals to the post-test odds divided by 1 plus post-test odds. A pre-test odds equals to pre-test probability divided by 1 minus pre-test probability. And a post-test odds equals to pre-test odds multiplied by the likelihood ratio. where the likelihood ratio for a positive test result equals to sensitivity divided by 1 minus specificity. We have come to the end of this topic. Thank you.